and so over to you, Aaron.
Yes, okay. So now I'm gonna share the screen. Just okay now. So hello everyone. My name is Chongpo Huang, and I'm from Taiwan, serving as one of the regional hub leads for the Western Pacific. Nursing has always been a passion of mine, and I'm excited to be on this journey with all of you. So I believe you can all see the screen right now. So what is Nursing Now Challenge? Nursing Now Challenge is formerly called, we know them as the Nursing Now, the Nursing Now and Nightingale Challenge formed together into Nursing Now Challenge, relaunched and currently running. The Nursing Now Challenge has connected me with incredible individuals whose dedication inspires me to drive change. Their commitment to nursing and healthcare feels my own, and I am honored to contribute to our shared goals. So now, the Nursing Now Challenge is a global call to action, and in the Western Pacific, it's a platform for our voices, stories, and ideas. And it's a network where we can truly make an impact. So from this screen, you can see our 4 foundational pillars, which is resource, networking, leadership, research, and innovation. So I'm going to delve into the Western Pacific right now. So you can see these are all the countries that are included in the Western Pacific. Currently, Nursing Now Challenge is actively working in 12 of those countries. And throughout my journey, I've worked with some of the most dedicated nurses from bustling cities to rural areas. Their commitment to providing excellent care is humbling. Despite the challenges we face, like limited resources and outdated practices, these are opportunities for us to unite and bring about positive change. So our current regional hub leads is me, I'm Chongpo Huang, also known Aaron. I'm from Taiwan, and the other one is Hazel Vera Tan. She's from Philippines. And we are still looking for 2 more regional hub leads. So do hit us up. Do send us an email if you're interested. Oh, I should go back to that one. Sorry. My vision for our region is a vibrant community of empowered, collaborative nurses committed to improving healthcare. And to achieve this, we need to invest in education, training, and professional development. Most importantly, we must foster unity among nurses across Western Pacific. Every voice matters, and together, we can amplify our impact and create lasting change. So to nursing and midwifery students and early career nurses and midwives, join us. Share your ideas, let your voice be heard, and help ignite change. Together, we can build a brighter future for healthcare in the Western Pacific and beyond. Thank you for this. I'm going to conclude my part. The QR code on the side, you can scan that, and that will lead you to the website that you can register to be part of the Nursing Now Challenge, Challenger Committee, and further, you will get the chance to get connected with me and Hazel, and you will have more resources and more chances to network and to connect with with other individual and professions. So now I'm gonna hand it to Sophia, our speaker for this webinar. This webinar is about innovation, education methods in nursing. And Sophia will be talking.
Hi, everyone.
Yep.
Yes, thank you for sharing Aaron's introduction, and it is my greatest honor and also pleasure to be here to share with you the topic regarding the innovative education in nursing education. I'm thinking that is a lot of nurses challenging, thinking how are we going to make our next generation, our nurses more knowledgeable and be able to respond to the clinical challenges. So today's my topic is actually sharing what we have been doing from the human to the new technology, which is the artificial intelligence or the open AI. So next, please. So this is me, sorry. So this is me, and my name is Sophia Hu, and I'm from, currently I work at the National Yangming Jiao Tong University in Taiwan. And I'm also an adult and gerontological nurse practitioner and trained in the US. So my background is a CVS, cardiovascular surgical intensive care unit, and also doing a lot of chronic disease management and medication and patient safety. And now currently I work in the university and also focus on the nursing education. So, okay, so next. So at the beginning of this webinar, and Aaron told me that I'm going to have 25 minutes. So I'm going to leave 5 minutes for the Q&A. And I would like to share with you my team. Without them, it is not possible to make this happen. So you can see a team is actually, we have a strong team from the, they have the background of the emergency room care. And they are from Taipei Medical University and also 2 of my PhD students. So when we are talking about the nursing education, first of all, I believe that all of you are going to agree with me that nursing is a hands-on profession. It's not like learning by in the lecture is not sufficient. So the clinical reasoning competence is actually very important because that is going to help us to facing the patient's condition changes or to identify their potential problems and to make appropriate reactions. So so let me remind you that what we learn in nursing when we learn those skills and knowledges that you can imagine the mannequins lying in the traditional nursing skill lab. And then we start to move to the simulation, indicating that we try to make the not only the skills itself, but also how we apply those skills in the real scenarios, like real scenarios. And that's, we call it a simulation. And now we move to the, not only the concepts of a simulation, like real, in the real situation, but we also want the students to feel it, they are immersed in the real situation. Now, with the technology, we even move to the artificial intelligence. So just bring back to your memories. Remember all those mannequins lying in the skill labs? And of course, before we try to use some technologies like a flipping classroom, we make a lot of video clips to help the students. They can do the self-learning before they come to the skill labs. However, we still think there is a gap between what they learn from the school and then to practice when they are in the clinic, and also facing the patient's conditions and the families, etc. However, once we experience the NOPS experiential learning cycle, you can see that actually the concrete experience is actually from doing and also a reflective observation. So when they are doing or when they observe others' behaviors, the learner still starts to conceptualize what they observed and categorize those behaviors, and then continues to be to process until it becomes their own experience. And also they will start to develop their own behavior and become their experience. So this is NOPS experiential learning cycle. In a very short words to express that is learning by doing. So when I experience this kind of theory over the module, over the model, it's kind of like start to change my teaching philosophies. So I try not to help our students to practice their skills, but also try to make them to start to connect the why they are doing that in responding in various situations. So the traditional, you can see that one faculty or the preceptor will have a group of students, and then to see how they practice their skills until it is appropriate and safe to be delivered to the real patients. And so particularly like the medication administration is also when we give the medication to the patients, the patient will immediately receive either the effects of the medication or the side effects, even the medication errors. So we really do pay close attention to when the students to prepare the medication. I'm going to show using the medication safety later as an example. So we mentioned about the gaps between the education and the real action, right? So we start to incorporate that simulation idea that provided students scenarios with the problems and with the issues that is actually happened in the real clinic. For example, that these photos, I'm going to use a lot of photos today with you to share to show you what the strategies that we have been using in our nursing education in Taiwan. Okay, so you can see that you see there are a bunch of the tubing tangled on the patients. So this is a situation that the patient in ICU, they actually do have a lot of tubes. So we ask the students how you transfer the patients even from the stretcher to the ICU bed. And of course, at the very beginning, students has no clue. But later on, we pose it and ask them to write down on the graph that you see there, and ask the students to, okay, now to think how you are going to organize the NG2, how you are going to organize the Foley and the IV, etc., and which IV you think that you can pose it for a second, like for the vessel constructors, or for the regular normal the normal settings, etc. We ask the students to think back based on their experience, and then figure out what are the potential what are the challenges they faced, and what are the potential solutions they can think of, and let them to practice again. So we start to bring these ideas. And you can also see that in the traditional CPR course, we teach the students the basic life support technique. So one preceptor will supervise the students, and they practice that. But with the technology, we find that this is a very interesting one, that the QCPR. It also it provides you can see that the students with one mannequin, you will be able to see the dips, the rate of chest compression, and even the break time. And also that with the high quality, they need to make sure the compression rate, the compression dips, and also no excessive ventilation. So from this QCPR, the students can visually see how they perform when they are doing the CPR. So I want you to see the next few photos. You can see the students, it's totally get their attention. They start to correct their postures, and also to you see they are so focused. Okay, so it's not the teachers to teach them how they perform. Actually, they see from the graph, and then to correct themselves. And you can see that we have 6 graphs, right? So we kind of like make it as a competition. So the students themselves, they feel it is kind of like a video games. They compete each other. So they really want to win. So they and then they really want to participate, and so it's kind of like engage them in the CPR performance. And this is another one I would like to share with you. So you can see that we have a group of people. We call it an education team. With this education team, we identify the scenarios that the students are more interested in. or they are going to facing when they start to work in the hospital. So we come up with the teaching plan. So this one is upper arms bleeding. So we also have a group of team, and we receive, of course, we received the support from the school that the secretary was sent out to do this kind of a makeup. So you can see how real the wound looks like. And so we provide the scenario, the background, the patient's vitals, and also so the students, when they come into this scenario, they know what to do. They will know that while they identify and assess the severity of the wound, they also need to stabilize the patient's vitals. And also the primary care nurse may not be the person who do all the work. So the nurse needs to delegate the tasks to ask the colleagues to come in to help. And this is another thing that we do is to we know that a lot of students, when they involve into the transportation or transfer the patients to another unit or to the lab or to the imaging labs to do some examinations, they don't know what to bring, and they don't know they need to monitor the patient's vitals when on the transportation. So we have a scenario to teach the students how they place the monitors, how many tanks of the oxygen they need to bring, and how many nurses, even the doctors, may need to come with the students. And of course, after the scenarios, they need to have the debriefing to discuss what they have been doing well or not been doing well during the scenarios. And this is another thing, is not only the medical and surgical, and we also do the one scenario is the postpartum hemorrhage. So the students, they need to not only monitor the amount of the bleeding, and also to monitor the uterine hardness. And you can see that at the beginning, the students did not notice there is a blood on the floor, and they just step on the blood and make the floor very, very messy. And after the scenarios and with the faculty debriefing, you can see that there is a lady with the yellow badge. She is the faculty, and during the entire time, she also monitored and check the behaviors that we are looking for. So we will be able to do the debriefing with students after the scenario. And this is another thing that I would like to share with you. We even involve the doctors and the students. They will be able to do the CPR, ACLS, because that is the most stressful situation for the new graduates when the patient needs to have the CPR, they don't know what to do. And before the resuscitation team arrives, they need to be on the site for the first 3 minutes. Okay, so that is how we train our new graduates, train our students. And when I see these pictures, you can see the students, they start to form a team, and they each know their role and responsibility, and then really collaborate well. Okay, so how we do in a simulation, and how does that help? We do publish our results in the Nurse Education Today, which is a Q1 journal in nursing field. So you can see that only by doing, even though by practicing in our in those scenarios before and the post test, and with 2-hour simulation practice, we see the differences. So this is the results that we have, and you can see that after the test, the control groups has an average score of 4.256. We have this is the using the medication administration errors. There are 8 errors we want the students to be able to identify. So the control group students, after the in the second scenario, the second time, they will be able to identify 4. And the experimental groups, which is not only practicing, but also with 2 hours debriefing with the faculties. So they have a higher score. Okay, another thing is, okay, so both groups, so you can see the experimental groups actually perform better than the control groups, but how great it is. So you can see the effect size. For the control groups, the improvement is 6.33 compared to the pretest, but for experimental group, actually the effect size is 22. So in this way, it's kind of like support not only to practice in the scenario, but also encourage the faculties to guide the students through this learning process, to help them to think through their observations, and also to develop their own concepts. So with the knobs experiential model, you can see the concrete experience giving the medication through the observation by themselves, themselves practice, or by observing others, and they start to conceptualize what they learned from that experience. And the faculties or the students, or we can call them the participants themselves, they will be able to develop their own idea or the strategies and become another new experience, and making the medication administration process safer. So at the beginning, you can see that is all the actual human context. And after that, with the technology involved, we start to use the virtual human. So this is a commercialized products. It is DXR clinician. If you are interested in, you can do search it online. And however, there is no conflict of interest with me and the manufacturers. Okay, so you can see that there are various scenarios, and the students, they can click it in and to start to practice by asking the virtual patient the questions. And however, in these commercialized products, every question is presettled. For example, you cannot ask the patients by entering in, how are you doing today? What brings you in today? It's going to be all the list of the questions. You can only highlight it and then select the questions has been entered already by the system. Okay, so that was in the past. However, the students are still be able to select the questions they would like to ask ask, and then gather the answers from that and start to develop their own differential diagnosis, and then and thinking and to think what else and what's going on with that patient. And then the students will be able to move to, after they collect sufficient history, and they make the potential diagnosis, and they can move to the physical examinations by clicking, like using the eye to see the patient's whole body, or to choose the stethoscope to listen to the chest, the lungs, or the heart, or abdomen. By selecting those, just like doing the physical examination on the real patients. So that is the commercialized patients. And then in the past, we start to incorporate the concepts of the simulation. However, it is still human. It is still very time consuming and very manpower required. So I would like to introduce you my university, the National Yangming Jiao Tong University, which is the university Aaron went to in Taiwan. And the National Yangming Jiao Tong University is actually a merge of two universities. One is the National Yangming University, another is Jiao Tong University. And Yangming University is actually a university which is very healthcare focused. So we have the medical, the College of Medicine, and the College of Nursing, and also the College of Pharmacy, and also the bioengineering. So it's healthcare focused. And the Jiao Tong University is technology focused. So 4 years ago, two universities merged together. So we want to apply the technology in the healthcare field. So that brings me into the new chapter. So you can see the picture here. Sorry. So those are the professors. One, you see me in the front, nursing, and my PhD students at the back. And then the two purple one is the professors and also the PhD students from the photonics department. And the professor in front, he is from the information and communication technology. And my interest is actually in the medication administration safety. So you know that a lot of medication errors are actually from the injection medications. So that is why you see the arm. So I talked to these two professors and asked them to give me some ideas. How can we train the students, not by closely observing their behavior, but also the students will be able to self-learning. So the professor from the photonics sharing with me, okay, when you give a medication in the patient's arm, we will be able to use the spectrum, the light, to identify the medications by the concentration and by the light spectrum, and to tell you what medication actually you give to the to the patients. So my students start to learn with the master and the PhD students in the photonics department. So they start to work together, the students, to explain what is the medication injection medications, and other the students from the biophotonics tell us how to do the to examine the content of medication. So this is kind of like beyond my knowledge. By like observing the students, we aspirate the medication, and then now we can see that is possible. The students will be able to prepare the medication by themselves, and then we can monitor, do they give the medication correctly, and the dose correctly, or the injection rate correctly, and also what medication they give to the fake arms. And another professor from the information and communication technology, he told me that, oh, it is very simple, right? The human eyes looking at the objects, like the labels of medications, actually, you can see that is how on the top portions, how the brain to identify and make the judgments if that is the correct medication we give to the patients. And then that is similar, that the technology, the graph recognition can actually use a camera like our eye to look at the label, and using the computer to process that imaging and to identify if the students or the participants selects the right medication. So here it is, my new toy. So you can see that the students will be able to see the scenario. You can see there is a little monitor there. We give the students a scenario like the patient's condition, and also what time they need to give the medication to the patient. And the students start to pick the right medication and pour in this pill box, and then put it back to the camera and close the door. And the computer will start to recognize by the shape of the medication. So you can see that the student, this is actually my office, okay? So it doesn't require a very big space. So the students will be able to give a medication by identify the right medication and put into the little container you can see on the second picture, and even by injection medication, and also give the medication into pretend that give the medication into to the patient. And if you have the money, of course you can have the standardized patient sitting there. If you don't, you can have a mannequin sitting there. It doesn't matter, because the machine will identify what medication the patient give to the students give to the patients. And at the end, the computer will also give the report to the students. Of course, this is our pilot study. So you can see we still have the faculty to teach us, to tell the students what they do well or what they do not correct. So the students will be learn from their behavior. Okay. So that is what we have been doing. And this is another thing, that is the virtual reality. So you can see that we share with the students. It is in the OR. So the students will be able to search around and zoom in and zoom out. And this is this table actually tell the students that you are in the OR, and this is the nurse anesthetist. And the nurse anesthetist is actually demonstrate the students that is the BP monitor, and that is the medication card. And this is the cards that you can identify looking at the patient's record. And this is their the machine for anesthesia use, so they can check the patient's schedule. I'm sorry, it's supposed to have the sound, but however, that is in Mandarin, so I'll translate it to you. And after the students look that, they can see the question and they can select. And actually the question is asking what are the important information that you need to do when the patients are doing, and the students will be able to click the right answers, and then they can learn, do they answer it correctly? If not, they can look back and to rethink why, or they need to select it, well, why not? It is not the correct answer. So again, that is back to the, so again, that is, so next. So again, that is back to the concept of the simulation, right? And then we train our students by doing, not only teaching them those skills, not using their own imagination, but we try to provide them the like real situation before that is all happen in the lab. And then with the technology helps, it can happen online, it can happen virtually. Okay, so this is our family nurse practitioner students. They using our VR. So they can use their smartphone, and then start to practice that. So you can see the students, they are actually very concentrated on identifying what are the questions that they are, the VR is asking, and then they can start to write down notes and then try to find the correct and appropriate answers, and making the diagnosis. So the students, they can either use it by phone, or they can wear the helmet, so they can have more immersed idea, immersed feeling in this kind of 360-degree view. And this is another thing that our my students my PhD students are developing. So this is for the patients who has the cancer, cachexia. So this is the learning objective. Sorry, it is all in Chinese. However, the main thing is that the students will be, or the patients, they can ask the question, any questions in 18 fields. Okay, so you can see that type of response. So the students or any participants, they can start to do the free text typing. So once they type in, like, for example, you can see on the third graph, I'm asking, actually, how do you know that this patient do have the cachexia or not? And once I entered that, And the AI can start to pick up that information like cachexia and signs and symptoms or the diagnosis, and the AI will start to respond to my question. So you can see that it meets one of the 18 objectives. So once on the first photos, I'm showing you, once we have that information, you can start to free text typing another response. So for this one, you can see that how to treat the cachexia. I type it very simply. However, the AI can identify the treatment and strategies. So it says, oh, it cannot completely managed by the medication. You can do the prevention, like minimize or prevent the muscle loss or the control, the weight loss, etc. Okay, so remember before, when I have the commercial products, the DSR clinician, it's all pre-settled. So I can only select the questions that I like to ask by the list of the questions. So it's kind of like whether or not I know, I can get a sense from the list of the questions the system provide me. But in the AI, in this system, you can see that I can type the messages over the text in the area, and the computer and the system will be able to respond back to me. We actually have two books in this to share our experience and how to develop this education plan and using the virtual reality design, and to share with the faculties or whoever who are interested in Taiwan. So I'm thinking that people can learn from our experience. Of course, we have this is because people, they have experience help us to develop. So we really try to help each other so we can walk faster. So at the end of my presentation, I would like to share with you what are the important in the nursing challenging and how we respond to that. Always remember what is the most important. Like the competency should be focused, because in the undergraduate education, we want to educate the nurses who are capable in patient care, right? So every education purpose or the learning objectives should fit that, and you need to know what competence you are training your students. So not every competence be trained in one class. So you can have a curriculum design and then also understand at what point of time or in what course you educate your students what. And also engage your students in the process. And once you motivate them, remember they are the adult learner. They will be able to learn by themselves and by their experience. So sometimes you think it is very difficult. However, like the examples I shared with you that I had talked to the professors in the photonics and the information communication technologies, they think it is very easy issues for them to solve. So always remember to collaborate with your colleagues, but sometimes can beyond your disciplines. Okay, and then always try to be creative and then bring the new ideas in. Another thing that I think is very important is fun. It's not only fun to your learner, but you need to feel it is fun for yourself. Otherwise, you will feel like you're going to feel like you are exhausted and burn out very fast. Okay, so of course, we're facing the challenges every day, but we also have a strong community to support each other, as Aaron mentioned at the very beginning. So thank you very much for to be here with me today. And then if you have any questions, welcome to ask. And I will give then that is my email, and welcome to email me, and I will give the microphone back to Aaron.
Okay, no, thank you, Professor Sophia, for like accepting my invitation to speak to all of us today. I mean, it's a lot of information. It's very new to me because I believe, like most of us in the audience today, we probably are not students anymore. So it's very informative that we can know more. So now we're going into the Q&A sessions. I can see a lot of people are raising their hands. So if you want to ask the question, let's start with Payam. You could
Yes.
send in a question or unmute yourself. Yeah, please.
This is Professor Hiam from Jordan. Thank you for this amazing lecture. And as I mentioned in the message, I joined late. I missed the timing. And thank you that we will have the record. But my question for Professor Sofia is what she has just shared with us. Can she have it in another language other than the Chinese if we invited her as a guest speaker for one of our journal clubs to share their experience with us? Thank you.
So far the two, if I understand your questions correctly, the only two languages I can use is the Mandarin and English. So if you can accept the English as a communication measure, so of course, yeah. And actually, we do research projects with the colleagues from the Indonesia and also Thailand. We translate all the simulation materials, so they will be able to open it and to apply it on their students. And that is another interesting study results. You can find that in the nurse education today. We compare the students' performers in across 3 countries, and you will be amazed. Even with the same situation, the students making the various different types of the medication administration errors. Which is telling us that we assume the students learning what we taught them, but in the real life situation and with a lot of noise, they will respond differently. And the faculty should learn from their reactions and modify their teaching materials and focus on the areas that students make the most error with. Yes, I hope that answers your question.
Yes, thank you. Thank you so much, Professor Sofia. Thank you.
Okay, now then let's move on to the second Nahla. Okay, well, I'll jump into the question in the message. Thank you for the excellent presentation, Professor Lingan Matthew. I especially appreciated your insight on competence, engagement, collaboration, and creativity. These keys are critical to driving innovation and effective teamwork, particularly in a multidisciplinary environment. Could you please elaborate on how you see these elements evolving in the near future and what steps organizations can take to ensure they remain at the forefront of these competencies?
Okay, thank you for that question. I think that is very important one. When we initiate this kind of simulation concept in our education, you can see that it does require a lot of money, time, and the manpower. So first of all, you need to have a group of people who has a similar interests with you, and they also see the challenges and difficulties. And another thing is sometimes we ask the students to collaborate because you know that in the healthcare systems, we need to collaborate with other disciplines. So we start to think the faculties needs to work together. So you probably start to hear the concepts of IPE, interprofessional education. So we start to initiate that idea at the very beginning in the nursing education. So the students, they start to get used to know another disciplines very early on, not only for the nursing students, but also for the medical students as well. So they will know the role and function with nurses. So when they start to work in the acute care settings, they will know how to collaborate with our nurses. So I'm thinking the communication skills, of course, is very important, and you need to have your own profession, and you will be able, you also need to let another profession to understand your difficulties. So you start to see now we have the students, we encourage them to have the dual degrees, or at least to take some courses in other field, so they will know their strengths. We don't ask them to become the experts, but we ask them at least to have some ideas. So in the future, when they experience the difficulties, they will know which disciplines or which profession they can start to approach, and then seek the solutions or to seek help.
Thank you for that question and its fabulous answer. I think it's quite important that we take initiative as this align with our Nursing Now Challenge. The goal is to take initiative to things, not to be afraid of trying new things, bridging gaps, reaching out to different peoples around the world. Once again, is there any questions? I don't think so. Okay. So now our colleagues have put out a poll in. Okay, for the recording, we will release the recording of this session on our YouTube page in a couple of days. So please check that. We will not send out the recordings privately to individuals. Okay, so our colleagues have put out a poll to see, are you a member of Nursing Now Challenge right now, or are you a registered nurse? Thank you again to Professor Sophia and Aisha, our program director, Aisha Holloway, for joining us today. I'm very delighted that there's so many nurses, early career nurses, senior nurses, educators, or even nursing students, students in midwifery or in nursing joining us in this webinar today. As I mentioned in the beginning, we are launching this education webinar series. So please look forward to that. We will have more interesting and excited webinars to come. How can I be a member? You can search Nursing Now Challenge on Google. How do we? Yeah, yes, our colleagues have put in the links in the message box. You can enter that link and fill in the form. You can join Nursing Now Challenge as individuals or as a group in the institution. We have Nursing Now Challenge have been working in a lot of different Asian countries, Western Pacific countries, European countries. We are working under the structure of the 6th region under the WHO structure. A lot of countries have their own Nursing Now Challenge. So you can reach out to different nursing associations within each country to see if there's more information you can get from them. How do I know am I a member or not? This is an interesting question. You can please reach out to us via the email on our Nursing Now Challenge website. Or yeah, I think this is that. Yes, we have our lovely Ann Chan and the participant today. Oh, okay. Did I answer every question? I see there's still people raising their hands. If you want to unmute yourself or put in the question in the message box. Okay.
Hello.
Thank you, everyone. Oh, yep.
Just a quick comment. So thank you very much for the lecture, Professor Sophia Hu, and this connection between nurses around the world. Can you hear me perfect? Okay, sorry. I would say I've been working on tuberculosis topic, and last week we were mentioned about how to introduce the steps of procedure regard of cascade of care around the TB infection, but the education lens, like how to connect and how to empower nurses around the world, how to lead and create the autonomous procedure to make nurses confident, to make them, the subject of the decision-making process. So I think your education presenting with the interface or with the technology stuff make it bright, because nurses can see how capable they are. So this is exactly we are talking about. This is exactly the call of Nursing Challenge is doing in every webinar, in every call, and I I'm very happy to be spaced to participate in somehow. It's not always, but when I participate, I feel that we have some peers to connect and make it a high level discussion. So thank you very much.
Thank you very much
Yes.
for your comments. I think that is the beauty of having the technology to help us and to help us to help each other. Yeah.
Okay, so on this, I'm going to close this webinar. I mean, in this ever-changing world, ever improvement, like evolving technologies that we have right now, it's scary, but it's also very interesting and exciting at the same point. So for Nursing Now Challenge, we invite you all to like participate in our campaign, our movement, initiative change, and let your voice be heard. So thank you everyone for joining today, and we'll see you on the next webinar. Please do join us. Goodbye. Thank you everyone. Thank you, Sophia.
Bye, bye, bye.
Bye,
Well done.
everyone.
Bye, everyone.
Bye.
Bye, bye.